Is your period late? Before you start worrying about the possibility of being pregnant, it's important to know that there are several other reasons why your period might be delayed or even missed altogether. The menstrual cycle can be influenced by a range of factors, from lifestyle choices to underlying health conditions. While pregnancy is often the first thought when a period is late, it's far from the only cause. Menstrual irregularities are quite common, and they affect many women at some point in their lives. The length of a normal menstrual cycle typically ranges between 21 and 35 days, with 28 days being the average. However, this range can vary widely depending on a number of factors. In this comprehensive guide, we'll delve into 8 potential reasons why your period might be late or absent, even if you're not pregnant. By understanding these causes, you can better manage your menstrual health and know when it might be time to seek medical advice. 1. Stress. Stress is one of the most common culprits behind a missed period. When you're under significant stress, whether it's due to work, personal issues, or even global events, your body goes into what is commonly known as the fight or flight mode. This response is a natural mechanism that has evolved to protect us in times of danger. However, in today's world, where stress is often chronic and not linked to immediate physical danger, this response can have negative effects on your health. When you're stressed, your body releases cortisol, a hormone that helps you deal with the stressor. While cortisol is crucial for short-term survival, prolonged stress can lead to an imbalance in your body's hormone levels, including those that regulate your menstrual cycle. High levels of cortisol can suppress the normal levels of reproductive hormones, leading to missed or delayed periods. In some cases, chronic stress can even lead to a condition called hypothalamic amenorrhea, where the brain stops sending signals to the ovaries to release eggs, causing menstruation to stop altogether. If you suspect that stress is affecting your menstrual cycle, it's important to find ways to manage your stress levels. Practices such as mindfulness, meditation, regular exercise, and adequate sleep can help lower cortisol levels and restore hormonal balance. In some cases, talking to a therapist or counselor can be beneficial in managing chronic stress. 2. Changes in sleep schedule. Your body's internal clock, or circadian rhythm, plays a significant role in regulating your menstrual cycle. This rhythm is responsible for managing various body functions, including your sleep-wake cycle, hormone release, and even your periods. When your sleep schedule is disrupted, whether due to shift work, travel, or staying up late frequently, it can throw off your circadian rhythm and, consequently, your menstrual cycle. Research has shown that disruptions in the circadian rhythm, such as those caused by crossing time zones or working night shifts, can lead to irregular periods. For example, a study published in Frontiers in Endocrinology found that women who experienced disruptions in their sleep patterns were more likely to have irregular menstrual cycles. The exact mechanisms aren't fully understood, but it's believed that changes in sleep patterns can affect the production and release of hormones that regulate ovulation and menstruation. If you've recently changed your sleep schedule and notice that your periods are irregular, try to establish a consistent sleep routine. Going to bed and waking up at the same time every day, even on weekends, can help regulate your circadian rhythm and support a regular menstrual cycle. 3. Being underweight. Body weight plays a crucial role in maintaining a regular menstrual cycle. Women who are underweight, particularly those with a body mass index, BMI, below 18.5, may experience missed periods or even a condition called amenorrhea, where periods stop altogether. This is often due to the body's response to low energy availability, meaning that the body doesn't have enough energy to support both basic functions and reproductive processes. Low body weight can be a result of various factors, including eating disorders such as anorexia nervosa and bulimia. In these conditions, extreme calorie restriction and excessive exercise can lead to a significant drop in body fat. Fat cells play a role in the production of estrogen, a hormone that is crucial for ovulation and menstruation. When body fat levels drop too low, estrogen production decreases, which can disrupt the menstrual cycle and lead to missed periods. It's important to recognize the signs of an eating disorder and seek help if you're struggling with body image or eating habits. Healthily regaining weight, typically through a balanced diet and appropriate medical supervision, can help restore normal hormonal function and make your periods regular again. 4. Intense exercise. While regular exercise is beneficial for your overall health, including your reproductive health, engaging in too much intense exercise can have the opposite effect. Women who participate in high levels of physical activity, especially in sports like long-distance running, gymnastics, or ballet, are at risk of developing a condition known as exercise-induced amenorrhea. This occurs when the body's estrogen levels drop too low due to the physical and energy demands of intense exercise. Estrogen is a key hormone in the regulation of the menstrual cycle. It helps build up the lining of the uterus during the first half of the menstrual cycle, preparing the body for a potential pregnancy. When estrogen levels are too low, the menstrual cycle can become irregular or stop altogether. In athletes, this condition is often seen as a part of the female athlete triad, which includes low energy availability, menstrual dysfunction, and decreased bone density. If you suspect that your exercise routine is affecting your menstrual cycle, it's important to reevaluate your workout regimen. Ensuring that you're consuming enough calories to match your energy expenditure and possibly reducing the intensity or frequency of your workouts can help restore your menstrual cycle. Consulting with a healthcare provider, such as a sports medicine doctor or a gynecologist, can provide guidance on how to maintain a healthy balance between exercise and menstrual health. 5. Thyroid dysfunction. The thyroid gland, located at the base of your neck, plays a crucial role in regulating your body's metabolism and hormone levels. When the thyroid isn't functioning properly, it can lead to a range of health issues, including menstrual irregularities. There are two main types of thyroid dysfunction that can affect your menstrual cycle: hypothyroidism and hyperthyroidism. Hypothyroidism occurs when the thyroid gland doesn't produce enough thyroid hormones. This can lead to a range of symptoms, including fatigue, weight gain, depression, and irregular or missed periods. On the other hand, hyperthyroidism occurs when the thyroid produces too much thyroid hormone, leading to symptoms like weight loss, anxiety, rapid heartbeat, and irregular periods. Both hypothyroidism and hyperthyroidism can disrupt the balance of reproductive hormones in the body, leading to menstrual irregularities. Fortunately, thyroid disorders are treatable with medications that either replace the missing thyroid hormone or reduce the production of excess hormone. If you suspect that a thyroid issue might be affecting your menstrual cycle, it's important to consult with an endocrinologist for a diagnostic blood test and appropriate treatment. 6. Medications. Certain medications can interfere with your menstrual cycle, leading to missed or irregular periods. For example, antipsychotic drugs, which are often used to treat mental health conditions like schizophrenia or bipolar disorder, can cause an increase in the hormone prolactin. Elevated prolactin levels can suppress the release of hormones that regulate ovulation and menstruation, leading to amenorrhea or missed periods. Other medications, such as some types of birth control, can also affect your menstrual cycle. Hormonal contraceptives, like the birth control pill, patch, or intrauterine device, IUD, work by altering the levels of hormones in your body to prevent pregnancy. In some cases, these contraceptives can also lead to lighter periods or no periods at all, a condition known as contraceptive-induced amenorrhea. If you're taking any medications and notice changes in your menstrual cycle, it's important to discuss these side effects with your healthcare provider. In some cases, adjusting the dosage or switching to a different medication may help restore your regular menstrual cycle. Missing a period can be a source of anxiety, especially if pregnancy is a concern. However, as we've discussed, there are many other reasons why your period might be late or absent. From stress and changes in sleep patterns to underlying health conditions like POS or thyroid dysfunction, a variety of factors can influence your menstrual cycle. If you're experiencing irregular periods, it's important to pay attention to your body and consider whether any recent lifestyle changes or health issues might be affecting your cycle. While occasional irregularities are usually nothing to worry about, consistently missed periods or other concerning symptoms should prompt a visit to your healthcare provider. Early diagnosis and treatment can help address any underlying issues and restore your menstrual health. Remember, menstrual irregularities are common, affecting up to 14% of women in the United States. By understanding the potential causes and seeking medical advice when needed, you can take control of your reproductive health and ensure that your menstrual cycle remains as regular as possible. If you found this video informative, please share it with your friends and family. Don't forget to subscribe to our channel for more educational content on women's health and wellness.